Hello, my name is Drake Basson, and I am a nursing student at Indiana State University. And this is a presentation for my community health nursing course 444 on women are at increased risk of developing breast cancer. Here are my objectives: to determine the prevalence of breast cancer among women, risk factors that cannot be changed, risk factors that can be changed, prevention of breast cancer, screening for breast cancer, and the future of breast cancer and surveillance. Before I get with the rest of the presentation, let's pause for a pretest, please. Thank you for taking the pretest. Now we'll begin the presentation. Prevalence of breast cancer among women. Out of every 8 women, 1 will have a chance of developing breast cancer. Being born a female and age are the most defining risk factors of breast cancer. African American women have a higher chance of getting diagnosed before the age of 50. The mortality in African American women from breast cancer is higher than others. The BCRA or BRCA gene is most prevalent in Jewish populations that can increase the risk of breast cancer. Breast cancer is the most prevalent cancer diagnosed in all U.S. women. Having a close relative, such as a sibling or a parent, greatly increases or doubles the chance of getting breast cancer in your lifetime. Risk factors that cannot be changed: being female, the aging process, having genetic dispositions that are known to cause breast cancer, having a family history of breast cancer, being taller than average, breast tissue that is dense, early puberty before the age of 12, late menopause after the age of 55. Risk factors that can be changed: regular exercise, eating whole nutrition with fresh fruits, vegetables, and less processed foods and sugars, minimal alcohol consumption, avoid all smoking, nicotine, or stop, weight management, avoiding obesity, being aware of family history and take steps to maintain healthy life choices. Prevention of breast cancer. Being aware of personal risk factors is important to prevention and/or early diagnosis. Modify lifestyle by choosing to exercise daily for at least 30 minutes, choosing healthy foods to consume, avoid alcohol or limit the amount consumed, not using hormone therapies after menopause, breastfeeding, surgical procedures for higher risk individuals with BRCA1 or BRCA2, medications known as endocrine prevention that prevent hormone-related breast cancers such as estrogen-driven. Screening. Screening is used to decrease the amount of people that are diagnosed and to decrease death rates from having breast cancer, to determine if and who is at higher risk for breast cancer and modify their screening if needed more frequently, self-examination of breast once a month, professional exams once a year, and radiologic exams such as MRI, ultrasounds, and mammograms when appropriate for the individual risk factors and age. Here are some symptoms to be aware of and to get medical attention for. Most women do not actually have any physical symptoms before being diagnosed with breast cancer, first of all. However, any breast changes or hard lumps felt, or a nodule or lump under the arm or the armpit area, nipple drainage or changes in the nipple itself, like inversion, redness, swelling, or a rash or skin changes in the breast or breast area, pain that lasts in an area or to the breast should be also a reason for medical attention. Future and surveillance of breast cancer. Researching the causes of breast cancers related to hormones, toxic exposures from one's environment. This will help in prevention of breast cancer. Implement ways to diagnose and treat breast cancer early on as much as possible. Manage individualized plans of care specific to each breast cancer diagnosis, since the causes are often not the same. Surgical interventions as prevention and treatment standards, including lymph nodes. Using radiation at lower levels whenever possible, and offer therapies for prevention and treatment to women that are at higher risk due to their genetics or family history of breast cancer. In conclusion, overall, breast cancer is the most often diagnosed of all cancers in women. All women are at risk for developing breast cancer, especially with each decade of life. There are known disparities in minority populations such as African American and Hispanics from diagnosis to treatment of breast cancer and less survivors compared to Caucasians. Eastern European origins have a higher rate of genetic abnormality related to BRCA1 and BRCA2, which are highly related to breast cancer and some ovarian cancers as well. Education to specific populations and awareness is vital to early screening and diagnosis, as well as ultimate treatment if needed. There's also a good tool used by the National Cancer Institutes for it's a breast cancer risk assessment tool, and you can click on the link below to visit that. And also another source as good as the nationalbreastcancer.org, good website for additional information on breast cancer prevention and awareness and screening and treatment options, and a good resource for patients and individuals in general. Please don't forget to take the post test. Thank you for watching my video. And here are my references if you would like to view them as well. Thank you again.